Today, I will talk about high blood pressure. Most people are unaware of their high blood pressure, and of those who are aware, don't have it under control, 70% of the time. What does it mean to have a high blood pressure reading? It means that your heart is working harder than it should to pump blood, and your arteries are stressed, which puts you to face an increased risk of stroke, heart attack, kidney disease, and other deadly illnesses. According to recent AHA 2025 guidelines, you are considered to have high BP when systolic pressure, or upper number, is 130 millimeters of mercury or higher, and the diastolic pressure, lower number, is 80 millimeters of mercury or higher. So get it checked, follow your doctor's advice, but remember that the cornerstones of treatment are exercise and diet changes, along with prescribed BP-lowering medication. We can start tackling the problem in the kitchen. Studies in USA have shown that a diet known as DASH, short for Dietary Approaches to Stop Hypertension, is very effective in lowering BP. This diet is low in saturated fat and cholesterol, high in fruit, vegetables, whole grains, and low-fat dairy foods. Such a diet can produce a reduction in blood pressure in as little as 2 weeks. Eating too much salt causes retention of water, same as adding more liquid to an overfilled water balloon. Pressure rises. DASH diet, together with limited sodium intake of 1,500 milligrams a day, or less than a teaspoon of salt a day, results in considerable drop in blood pressure. Packaged and processed foods, especially snacks, meat products, and tinned soups, contain a considerable amount of hidden salt. So before buying, labels must be read carefully. Low-salt soups and biscuits should be looked for, and foods like beans canned in brine should be rinsed before use. Most shop bread contains high levels of salt and fat, so try making your own bread at home. It takes a few minutes to tip in the ingredients, and with a bread maker, within no time you have your homemade bread. The use of potassium-rich salt substitutes, KCl instead of NaCl, has demonstrated reductions in blood pressure and in cardiovascular events like stroke. It is true that we can decrease our BP by reducing the amount of salt we take, but contrary to the belief held or information propagated up till now, the effect is minuscule. Patients having a high stubborn BP are recommended to cut of all carbohydrates and sugar and have a high-fat diet. The low-sugar, high-fat diet will lower the insulin, and that in turn will lower the BP far better than cutting salt. Lowering blood sugar reduced the excess water in the circulation, and that is the first step to lowering BP. Low-salt diets make insulin more resistant and trigger the production of aldosterone, a hormone that helps the body retain sodium, increasing the risk of heart disease, cancer, and high BP. Major benefits are observed if 5 servings of vegetables and 2 servings of fruits are eaten a day. Research evidence based on well-designed studies suggests that intake of vegetables like beetroot and other nitrate-rich vegetables like spinach, rocket, arugula, and berries, especially blueberries, strawberries, and pomegranate, result in clinically meaningful reduction in blood pressure in most cases. Citrus fruits, banana, watermelon, tomato, avocado, and cruciferous vegetables, broccoli, cauliflower, and cabbage, contribute to lowering of blood pressure as part of high fruit and vegetable diet, especially the DASH diet, but effects in isolation are modest. Both fruits and vegetables are important sources of potassium, magnesium, and fiber, all of which help to keep the arteries healthy. Porridge, dahlia, has a soluble fiber known as beta-glucan, and a bowl of porridge a day helps to lower both the blood pressure and cholesterol levels. Whole grains, with research-based evidence of lowering BP, improved vascular function, improved insulin sensitivity, are oats, barley, brown rice, quinoa, whole wheat, millets, and rye. Intake of legumes like lentils, masoor dal, chickpeas, chana, kidney beans, soya beans, tofu, soy milk, peas has shown to improve vascular function and lower BP. Cutting back on alcohol to a drink a day in women and 2 drinks a day in men is required, as heavy drinkers have high blood pressure. Excess coffee consumption, more than 5 cups a day, is a contributing factor to high blood pressure, and this effect is more pronounced in young people. Lose some excess baggage. Extra weight forces the heart to pump harder. That's why blood pressure rises with increase in body weight. In overweight people, loss of as little as 5 kilograms of weight results in significant reduction in blood pressure. Stamp out those cigarettes. If you smoke, give up now. Compounds in tobacco smoke contribute to hardening of arteries by causing injury to blood vessels, while nicotine in cigarettes causes blood vessels to constrict, and this is especially bad for people with high blood pressure. Shaking a leg or two for at least 5 times a week, or at least 30 minutes of brisk exercise, running, brisk walking, cycling, and swimming, done regularly helps to keep resting blood pressure at a safe level. Consider getting a pet. Interacting with animals has shown to have a good effect on blood pressure. Learn to meditate, as research shows meditation lowers blood pressure, apparently by lowering levels of stress hormones in your body. Meditate at once or twice a day for 10 to 20 minutes. Any stress-reducing therapy like yoga, tai chi, or similar mind-body skills will also help to reduce high BP and restore a sense of control and calm. Hobbies are just as beneficial as meditation. Spend some time regularly in doing things you enjoy or which relax and calm your nerves. Supplement your efforts with magnesium. It allows the blood vessels to open wide by relaxing the smooth muscle lining it. Magnesium is especially effective at reducing high BP associated with pregnancy. Magnesium tab or capsule in the form of magnesium citrate or gluconate is preferred as it has gentler effect on the digestive tract. If you take magnesium, be sure to take calcium as well. But take it at least 2 hours apart for maximum absorption. The recommended dose for lowering BP is 400 mg magnesium and 1000 mg calcium a day. Potassium also lowers BP, so aim to eat foods high in potassium and low in sodium for maximum benefit. Hawthorn or Crataegus oxycantha is a herb which is known to dilate arteries by interfering with ACE enzymes. Its dried berries mixed with rose water or honey are used as a calming heart tonic and for restoring weak heart function. It is the key treatment for high blood pressure associated with atherosclerosis. Those on medication for high blood pressure should consult their doctor before taking it. Eating a clove or 4 grams of fresh garlic a day, or taken as enteric-coated supplement, helps to lower blood pressure. Fish oil supplements with their omega-3 fatty acids inhibit the body's production of prostaglandins that narrow the arteries. Especially the good fats coming from oily fish, such as trout and salmon, in the dose of 1000 mg twice a day, encourage good circulation and help to reduce blood pressure. Flaxseed oil, 1 tablespoon a day, also helps in reducing blood pressure, but always check with your doctor before taking supplements. Studies have shown that noise of traffic can send BP soaring. Similarly, driving in heavy traffic increases our stress levels and may increase our blood pressure. There is nothing much we can do about it, but if we can, we must. Key study insights. 1. Nitrate-rich foods, beetroot, spinach, rocket, to be taken daily. 2.1 to 2 servings of berries to be taken on most days. 3. Potassium-rich foods, banana, citrus, lemon, and daily allium, garlic, onion, recommended for. Minimal added salt and processed foods. 5. 3+ servings day of whole grains is associated with 6% lower hypertension risk, as is 1 serving per day of legumes, as per 2021 systematic review, enough to meaningfully reduce stroke and heart disease risk. At the end of the day, sit back, seek peace, and protect your heart. Nature holds the gentlest answers to some of life's toughest questions. These simple home remedies are not just traditions, they are gifts of health, passed through generations. But remember, every heart is unique, so listen to your body and work with your doctor as you walk this path. If you found this information useful, join our Herbs and Hymns family, where healing meets harmony. Subscribe, share with a loved one, and let's keep the wisdom of nature alive together.